shall we start, Gill?
Yes,
Are you
let's
happy for us to
start,
start?
James.
Wonderful.
Yes.
Well, so I have the compere role this evening. Good morning, good evening, good afternoon, depending on where people are. And huge welcome to our August Kindness and Healthcare community session. My name is James Mountford, and I look forward to these sessions all the time. So much so that I've got two children upstairs having a little rest. We're in Madrid and we're going out to dinner afterwards, and we'll still be early by Spanish standards. So I'm going to be very, very brief, but I'm going to just sort of do the first orientation to this session and then hand over to Gill, who is going to both lead us through and invite in other participants. And is anyone here for the first time? If you are, I may not be able to see you, but I can see Claire waving her hand. And others may be waving their hands. I see Ruth waving her hand. So everyone is hugely welcome. The idea of these sessions is, and we've been doing them, I think, over 3 years now. Every month, on the third Thursday of the month, we explore some aspect of kindness as related to the delivery of, the planning of, the receiving of healthcare. And we've ranged hugely broadly. We've looked at education, we've looked at regulation, we've looked at community settings, we've looked at mental health settings, we've been all around the globe. And I think today is particularly fascinating. I have lots of excitement about what we're going to cover. And about 2 or 3 months ago, there was a session from Australia where Sean, who works in mental health recovery, was telling us about the sense of shame that patients or service users and also staff can feel around the conditions that they've got, the way that they're responding to them, and the overall situations that they find themselves in. And Gill and I, as we sometimes do, got into a little WhatsApp discussion. And we started talking about breastfeeding. Now, I don't have a great deal of experience of breastfeeding, except 2 children who largely did breastfeed. They're 14 and 12 now. But I guess it was quite easy for us, for my wife and my son and daughter. But I know that it isn't for everybody. And the conversation with Gill evolved a little bit along the lines of, why do we shame women in the UK, and I think in other countries, who are unable or unwilling for some reason they choose not to breastfeed? And there's a lot here that's very emotional. And there's a lot here that's wrapped up in, I guess, a sense of who's the agent, the child, the parent, there's the corporation selling the baby formula, there's the different contexts in which it happens, and there's controversy. We might get into this about some of the evidence. But suffice it to say, Jill said, well, did you realize that if you want advice on non-breastfeeding, you have to kind of click a link in the UK that basically says, I understand that breast is best for my child, but nonetheless, I want to go down this route. And that doesn't seem very kind. And so we thought this would be an interesting topic, didn't we, Jill? And you said, in your wonderful characteristic way, you said, well, I might be the Pied Piper to bring together a few people. Now, I don't think this analogy holds perfectly, because as I remember, the Pied Piper led a lot of people into a lot of trouble unwittingly. And I don't think that's what you do, Jill. I think you lead people to, new insights and new connections, with your wonderful idea of the lemon moment. Jill, you're going to kick us off for about 10 or 15 minutes. We're going to hear from you and some others. And then, as usual, we're going to go into breakouts. I can see there's about 50 of us in here, and Gabby and Suzie are going to mix the team's decks. And we hope that all works. So it's about a third of the meeting for people who are new, where we introduce this issue and hear from Jill and her friends. Then we'll have a breakout discussion around a question that we're going to give people. Let me just trail that. What insights can a kindness perspective bring to our breastfeeding? And more generally, how can our reflections inform how we behave as professionals and patients or service users in other areas. So again, as we always do, we explore kindness from a different angle, and we try and gain new insights that are relevant in the field we're discussing, but also far beyond, because the wonderful thing, well, one of many wonderful things about this is we have people from so many different walks of health and healthcare. So, Gill, over to you.
Okay, so
Thank
hello
you.
everyone, and thank you so much for inviting me to lead this session with my friends this evening. So I'll share the screen and bring up the presentation. Include sound we need. Right. Here we go.
Yeah, we got that.
So can you see that, people? Yeah?
We can.
Okay, so why on earth have I included a beach ball on my first screen? Answers in the chat, please. And I guess there are no wrong answers, but there is going to be one that's a more right answer that perhaps we'll come on to later. So now this may or may not make a noise. It's a very noisy hashtag, kindness matters, but I think everyone in this group knows that. And that's why I love this group. I'm so thrilled to see so many of my friends here tonight, because a lot of you will have heard me raving about my monthly kindness conversation. So I wasn't sure who'd come along tonight. I can't see everybody on the screen that I've got, but I've spotted Florence, and I've spotted Fazana, and I've spotted definitely my daughter Jenny, who's not on this photo, but you'll meet her later. So it's brilliant to see everybody here tonight, and thanks for supporting me. I can see basically quite a few of our MatX movers and shakers here. So what's MatX? You can see the banner that people are wearing, maternity experience. It's been a very noisy hashtag, and hopefully making a really big difference over the last 11 years or so. And I'm proud to have some of the friends who've supported that and led incredible campaigns over that time. So I'm hoping you'll get a chance to meet some of these people in the breakout rooms. I don't think we've got time, because James and Bob, who's sadly not here tonight, I'd love you to meet Bob. He's nearly always here, but he's away with his family in Norfolk. They keep us very strictly to time. So I don't think we've got time to introduce everybody, otherwise we'd never get round to the discussion about breastfeeding. But Florence, are you there? Would you like to say hello? So Florence is my co-founder of MatX. Florence Wilcock, FabObs Flow, that stands for Fab Obstetrician.
Hi, yes, I'm Florence, and coming back to the Pied Piper, she totally leads me into not disaster, but definitely mischief. So I met Gill, I was going to say 10 years, but it's actually 11 years ago, and we started looking at maternity experience. And at the time, everyone was like, safety is the only thing that's important. Why are you looking at experience? Why are you looking at experience as an obstetrician? That's a midwifery nursing-y thing. And we've come a long way since then, that people do actually seem to understand now that being kind and nice and respectful to people while you're giving them care is important, and is linked to safety. But equally, we've got a long way to go. You know, almost every week there's a maternity scandal or maternity in the news, and we've now got another national maternity inquiry, and we've had a national maternity review. So there's loads of work to do. In relation to breastfeeding, do you want me to say something now, Gill, or later?
Say something now. I think it helps set the scene. Thanks,
so
Flo.
For me, so as an obstetrician, I look after lots of women with perinatal mental health problems, and some of them are specifically not allowed to breastfeed. I should say allowed in inverted commas, as in the medication they're on for the sake of their mental health, particularly women I care for who have bipolar type 1, who have an up to 50% chance of postpartum psychosis. If they're on lithium, they are advised not to breastfeed. I've also cared for women with HIV who have detectable viral lows, who are also told categorically not to breastfeed to avoid vertical transmission. So the breast is best message is difficult if you want to breastfeed and you can't breastfeed and you feel guilt and shame and some of the stuff you've already mentioned. But there are also women that are specifically told not to breastfeed for medical and mental health medical reasons, clinical reasons. And we did discuss this briefly. I was at a perinatal mental health course at the Royal College, and we were talking about the fact that as part of the kind of maternity quality standards, we're all supposed to get this UNICEF baby friendly accreditation. And therefore, all units in the country, maternity units, are working towards this. And to achieve this, you have to do things like remove all the formula, lock all the formula in the fridge, have a sign in, sign out book for formula. And I understand the importance and the incentive and the kind of move towards trying to help people breastfeed, but actually it's not seeing the whole picture. So that's a bit of professional context. On a personal context, I did breastfeed my 2 daughters who are now adults. And for me, I'd had quite a difficult time giving birth both times. And I had an emergency cesarean both times. And I felt a complete failure both times. And breastfeeding was my only redeeming thing about being a mother. It was the one thing that I did manage to do. So I'm not anti-breastfeeding and supporting and promoting breastfeeding, but I think there's a balance and we're not in the right place.
Brilliant, thanks, Flo. And I think that's really set us off really well with that professional knowledge. And the people that I've invited along tonight, and I mean, I can't see everybody, but I'd like to give a shout out. There are several people who've been guests on my podcast. So Fazana's here, a GP in London, Goody Singh, Yvonne Newbold, a parent. I haven't got time to tell you who they all are, but Ruth and Annie and Claire and Jenny and Rachel and Diane, I can see all sorts of my gang popping up who, as far as I know, most of them haven't been on these sessions before. And why have I invited all these people? Basically because they're all kind people, really kind people, and they have probably personal and or professional stories relevant to this evening's topic, kindness in breastfeeding, because I think most people have. I find with the work I do, I talk to people and then they come out with their stories. So what's happened there? This is a proper Whose Shoes topic. So what do I mean by that? Well, some of you will know that I'm a creator of a tool called Whose Shoes, looking at issues from different perspectives. Oh, there's the beach ball. It really is like a multicolored beach ball, and Yvonne, who you might meet later, will tell you about a session that we did quite recently where we threw a ball around the room with different people's perspectives as part of a poem, and suddenly people see that you might have this fixed view, but actually there's other aspects that you need to know about. So I think the challenge really, and the reason for sort of agreeing to do this tonight, and I say thanks very much, James, it's been really interesting preparing for it, but I think hopefully challenging people to be a bit less certain and a bit more curious about everything really, what really matters to people. And when we do our Whose Shoes workshops, I'd say the same topics come up over and over again, regardless of the topic, in terms of what matters to people and what makes a difference. So perhaps I could invite you to put any ideas in the chat about what you think those regular themes might be. And language is always high on the list. So a shout out to Emma Jane. I'm not sure if Emma Jane's here tonight, but she's been very influential in terms of some of this negative language around maternity. So place your bets. We're going to spin the wheel and we're going to find out tonight's winner in the Unkind Medical Language in Maternity contest. Are you ready? Here it goes. So I think we're going to have She Refused. Oh no, we've got Incompetent Cervix. That's a bestseller, isn't it, Flo? So failure. In maternity care, women can feel as if they fail at pretty much everything, including breastfeeding, big time. And it makes them feel pretty rubbish, really, which is not the greatest start to motherhood.
Failure. I hated it when the midwife kept using the word failed. I started with a failed induction and then she wrote down failure to dilate. That word had a real impact on me and I just wanted to cry.
And then this very famous quote, which I'm sure everybody on the call will know, they may forget your name, but they'll never forget how you made them feel. So I think that's central to our discussion tonight. So we were asked to talk about our MatX Maternity Experience campaign at Skipton House, which is the headquarters of the NHS in England. So it was my moment of fame, really. And I was invited to talk to the then Chief Executive, Simon Stevens, Chief Executive of the NHS, and basically tell him all about it. And he was listening and we were getting on well and he was nodding and he was agreeing, but I wasn't sure that he totally got it. So I asked him how he would feel if he was told that he failed to dilate. And as you can perhaps see, there were a lot of cameras there, but somehow the footage never got shared on national TV. And that's been the story of my life, really. So kindness in breastfeeding, it's a very emotive topic. I posted about this session tonight on LinkedIn and it immediately sparked a debate, which has been rumbling on for the last few weeks. So I'd invite you to take a look at that if you're on LinkedIn and perhaps join in. But I can see that some of the participants tonight, like Claire, who I've met through this brand new for the first time, Claire Tower, and others have contributed to this. So kindness in breastfeeding, why is it a Who's Shoes topic?
The World Health Organization recommends that babies be exclusively breastfed for the first 6 months of life, and with continued breastfeeding up to 2 years old or beyond.
It felt like a cheese grater raking against my nipple.
You need to be tough. Lots of mums find it hard at first. It is best for your baby.
Your sister managed to breastfeed twins.
They will think I'm a bad mum.
So breastfeeding, breast is best. We all know that, or do we? What if we choose not to breastfeed? What if we can't breastfeed? What are the healthcare professionals and indeed society telling us? How can we all be kinder? So I'm delighted to have my daughter Jenny with us this evening. A number of people that I've invited along tonight have a similar experience to Jen. Here she is reading a poem that she wrote, which has been really influential in terms of helping people see the different sides of the beach ball. We hope that this introduction will spark some really rich conversations in your breakout rooms, and we look forward to hearing your lemon light bulb moments when we all come flying back into the main room later.
Breast is best. Breast is best, I used to agree, but it wasn't best for my baby, and it wasn't best for me. My baby wasn't getting enough, her blood sugar was low, my milk just didn't seem to flow. She was fidgety and distressed, clearly desperate for more, or too sleepy to care. It was too much to bear. My friend's baby had been rushed to A&E, floppy and unrousable. Dehydration was to blame. I was desperate to avoid the same. It had been a difficult birth, for what it's worth. Induction, forceps, loss of blood. Producing milk didn't seem to be my body's highest priority. Why wasn't there enough? I found it really tough. I so badly wanted it to work. Breastfeed, bottle feed and pump. That was the advice. At every feed, day and night. The midwife made it sound so easy. In reality, it was a constant cycle. No time for anything else. When was I supposed to rest? I was starting to feel very stressed. Breast is best for your baby. An important message for those who don't know, but it made me feel really low to hear it over and over again. Click here to confirm that you're a bad mum. It made me feel numb. It's not what it said, but that's what I read. At 8 weeks, I saw a lovely GP. She said, "Your little one is thriving." I'd thought we were just surviving. It's exactly what I needed to hear. Everything suddenly seemed clear. My baby was doing great, a healthy weight. No need to feel guilty anymore.
So thanks, Jenny. Thanks, everyone. And back to you, James.
Gill, Jenny, Flo, everybody. Now we know another use for a beach ball, don't we? That was amazing, and your thick multimedia skills are extraordinary, Gill. And Jenny, I think you're in the room. I can't see you on the screen, but that's a wonderful poem and a wonderful way of just bringing this into full relief, isn't it? I thought that was beautiful and beautifully read. So now it's all of our turns to have a discussion. And for those of you familiar with what we do, it's about 20 past the hour now. We'll come back at about 22. So we get a decent 20 minutes in the breakout. We don't monitor those. There are no outputs formally from them. But what we do is we want to bring back, as Gill alluded, the lemon light bulbs. So it's the penny drop moments, the things that make us see something in a different way that we can take with us and use. So I have a bit of a technical problem. I can't actually see the chat, but I think for people who can see the chat, the question that we're going to encourage, but not monitor your discussions around, I'll just repeat what I said before. What insights can a kindness perspective bring to breastfeeding? And then more generally, how can our reflections inform what we behave, how we behave as professionals and as patients and service users and staff in other areas? So that is our brief for the next 18 minutes. Gabby and Suzie, is there anything you want to say before you whisk us off?
I don't think so. I'm going to open the room.
Okay.
Suzie, do you have anything to add?
No, I think we're good to go. Please
Okay,
go and
whisk away.
whatever reasons brought you to tonight's conversation, please feel free to say whatever you want to say when you get into the group and just have a really great conversation. Over to you, Gabby. And we know this is the first time you've done this, so we are being kind and patient as you whisk us into other rooms.
Actually, I know what I will say. I'll click the button in a second. If you don't get allocated a room, there will be some of us in the main room. So if you drop off the call and come back, we will be here. Okay, let's see. I've clicked opening the rooms, so hopefully you'll all move away in a second.
Thank you, Gabby.
No worries. Interesting. I think this might be the group staying here because I can't see.
There's 11 of us here, it looks like.
Yeah, I'm trying to look at if I can move each of you individually.
Well, Gabby, if you can't, this is the group that was meant to be. So
yeah, I think it was meant to be.
But let's just run with it. may I just sort of encourage people to just pipe up, perhaps say really briefly who you are and open up the discussion.
Could I say something?
Please do. Benedict,
My name's Benedict. I'm not a healthcare professional. I'm a mum. I've got special needs children and I work as a special needs advocate. I think for me, this whole topic, as a woman, as a mother who has breastfed, and then I put in the chat my third baby failed miserably and then turned out to be tube fed for 15 years. So that notion of failure is important, but I'd always assumed that breast was best. I was brought up with that thing. I suppose what I'd like to ask anybody who works in the healthcare world, the question that's occurred to me listening to Gill, why do you care so much in the medical professional? Why? Because that's often what it feels like when we enter it. But it never occurred to me to actually ask, why has this breast is best message become so huge?
I will invite anyone to Andrew.
So I'll contribute. My name's Andrew Long. I'm a paediatrician, retired now. I've got 4 children, 7 grandchildren, and I have been working as a paediatrician for 40 years. I have to say that I have been passionate about breastfeeding and supporting breastfeeding because if you look at the history of the development of formula feeds, they have not been properly controlled in terms of the development of the products. And so the recognition is that there's a lot of things which are in breast milk which formula companies are only now adding as add-ons. And so there's a lot of things. There's also the hormonal parts of it. There is also the immunological parts of it, which cannot be replicated. Now, I think all of that is science-based and all of that is absolutely true. However, as a paediatrician, and I spent 20 years working in neonatal pediatrics, the most important thing to me is how the bond develops between the baby and their mum. And it doesn't matter whether that's through breast contact or through supporting mothers with formula feeding. That is the most important thing, and that's what we need to focus on. And the contents of the feed is, I think, of secondary importance to the importance of developing and supporting that relationship, which is where I think the whole kindness agenda comes into it.
Thanks so much, Andrew. I agree with you, by the way. I was passionate about breastfeeding and I looked into it an awful lot. Interestingly, what you say about the formulas, after my third child had been tube fed for 3 years, he was very, very ill. And I did a huge amount of research on formulas used in tube feeding and came to the same conclusion. I then had a massive fight with his dietitian, and I started a blended diet, which was miraculous for his health. So I agree with you, and I particularly love, as you say, if breastfeeding is causing that trauma between baby and mum, it's a disaster, isn't it?
Thanks, Andrew. That was a really helpful, I think, informed brief about the scope, because I think it's easy to think perhaps about the nutritional side and perhaps less about that bonding side. We're a big group. Let's invite, and I know looking around the group, we've got people who often have lots to say. So let's hear from others. Rachel, and then Lucy. Or you'll need to unmute, Rachel. I'm admiring your car roof as well, just like your own. Should we go to Lucy first, and then maybe you can, Lucy, with the bluest of skies I've ever seen.
Yeah, I'm on holiday in Bristol, and it's a beautifully
wonderful.
sunny evening. I'm Lucy. Sorry, I only managed to join about couple of I got the poem, but not much more, and a couple of the quotes, so I didn't see most of the other stuff. But I'm a chief operating officer in the NHS, and also a mum of 2. The thing that just strikes me in relation to breastfeeding is, as I'm kind of thinking about rates of breastfeeding in the UK compared to other countries, and I don't know loads about it, but where it strikes me there is more room for kindness is in the way that society treats people who are trying to breastfeed in public or in, frankly, anywhere. And I think we're not good enough yet at making really nice, safe spaces, comfortable spaces for people to breastfeed in a cafe, in a in a library, wherever they need to. And I think that, and the kind of over sexualization of breasts and how people behave over all of that can make it a whole lot more difficult for people in a way that is really truly unnecessary. So that's kind of what the conversation so far has made me think about.
Thanks, Lisa. Can we go back to Rachel? Can we hear you? Yeah. Oh, try again. No, I'm not hearing you, Rachel, I'm afraid. Maybe you can type something in the chat. Sorry. Right, where shall we go?
Hi.
Hello.
Okay.
Yes, come in, Roberta, and then Fazana, and someone whose surname's Chandler, and my little image of me is over my Leslie. I can now see your name. So let's go to Roberta, Fazana, and then Leslie. Go ahead, Roberta. Oh, I can't hear you either, Roberta.
Yeah, I couldn't either. That's strange.
Okay, well, this is very odd. What you might want to do, Rachel and Roberta, since this is the main room, you might just want to leave and come back in and see if it
Your return here.
cures. I have no better technical suggestion than that, but clearly there's something up, a gremlin. Fazana, are we going to be able to hear you?
Hi, can you hear me?
We can. Fazana, we can hear you.
Thanks. So I just had a few reflections, really. So I'm a GP and a mum of 2. So I'll start with the personal. Really touched by Jenny's poem because my now 22-year-old, nearly 23, was my first child. He was born 4 weeks premature, emergency cesarean section, and I'd been really sick. I'd been admitted with hyperemesis, with dehydration and vomiting, about 5 weeks before he was born at 29 weeks. And I'm a British Bangladeshi. Breastfeeding is very much something that's encouraged. My mother-in-law wanted me to do it. My husband wanted me to do it. So I did my best. He was born very small anyway, being premature. He was born at a birth weight of 2.3 kilograms. And then at his 6-week check, I probably had the most embarrassing time of my life being a GP. And they said, well, he's lost weight. Have you noticed he's yellow? I was like, oh, I haven't really noticed a bit yellow. And then I got the formula, and I just hadn't been making enough breast milk. And it wasn't so much, I wouldn't say I was ashamed. I think I just simply hadn't realised. And I think it was a lesson to me as a GP that, we really need to ask, because I was very unaware that I just wasn't giving him enough milk, and that the reason he was crying all night is because he was hungry. And then after the formula is fine. So I think that really helped me in my practice. And I guess the second thing I want to say was adding to Lucy's point. I mean, I love being a GP, and I think kindness goes so far in, every single consultation, doesn't it? Not just in breast or maternity or women. People, if we as human beings don't feel listened to, and we feel judged, we're not going to have safe healthcare. If you don't trust the person, particularly in my line of work, where there's still quite a lot of continuity despite it's being eroded, there is still quite some. If you don't trust, or you feel the person who's delivering your healthcare is judging you, by definition, you're not going to have safe healthcare, because you're not going to be able to tell them. But Lucy, it's been interesting for me is that like you say about public breastfeeding spaces, and obviously my kids are in their 20s now, but there seems to be so much more these days of designated breastfeeding areas in this shopping centre and that shopping centre, which is kind of much better than it was. Yet there's still so much prejudice. And then I bumped into this wonderful Somalian lady, thinking about different cultures, in the mosque I go to. And I mean, yes, we're all women in the area, but I loved the fact that she had her little baby with her. And this is like an hour and a half, this sort of Friday prayers. And she's just got her long scarf on, and she's just really comfortable, just sitting, and she's not exposing anything, but it's just she's so naturally able to do it. And I wonder what we can learn from other cultures about that real confidence that women of other cultures have. And as you said, and there was nothing sexual about that, no one's seeing anything, but why in the world in Britain do we think that these organs for ladies are simply sexual organs when the rest of the world doesn't seem to think that? So what can we learn from other cultures who are naturally feeding their babies? And I guess if we're not naturally feeding our baby, I mean, that's a loaded term. In a way I couldn't. It's just one of those things. I think for me, more than shame, I wish somebody had sat me down and just said, your baby's a bit yellow. That's probably because you're not feeding him enough, which I didn't know until 6 weeks later. Thank you.
Thanks, Susanna. The classic risk of being a doctor's child. We may have people with perspectives from outside the UK in the room. I don't know, actually. We may have Roberta and Rachel able to unmute now. I don't know. But let us go to Leslie and then Jane. And time is rapidly becoming our enemy. Gabby will cruelly take us back in 5 minutes or so into the big room.
Okay, just checking you can hear me, because
Yes,
I've had
Leslie,
real
loud and
problems.
clear.
Excellent, brilliant. I come from lots of different perspectives, and it's been fascinating. Even just the few minutes that we've been talking, giving me so much insight. I was a single mum who was unable to breastfeed, even though I wanted to. I was a student nurse at the time, so there was a lot of shame and, and I think the word, not just the shame, but I think when you talked about that feeling of failure. And also, as Fazana just said, about if you can't give that trust to your healthcare provider. I'm just about to start work, and I was a nurse. I'm now in organisational development, and I'm working with the maternity unit to see what we can do to make that culture better. And I think Fazana, just to say thank you for giving me that insight of, if you can't trust that caregiver, the health giver, and I wonder, why, what is going on there? Do midwives, struggle with that? Is there a struggle with the midwives in order to give that preferred advice, when, as Andrew said, it doesn't really matter either way? I mean, 30 years later, you don't know who was breastfed and who wasn't. It is just about the bond, about the mum. So it's been, fascinating insight. So I'm just curious if anybody's a midwife to sort of, to give that insight.
Thanks, Leslie.
Can you hear me?
Yes, let's hold in mind Leslie's points and questions as well, as we go to Jane and then Susan.
Hi there. Well, I want to say something which is maybe a bit provocative, really, but to me, I've worked as a GP all my life in a pretty rundown area of Sheffield, and it's a big class issue. It's a massive class issue. And basically, you ask some working class girl if she's not going to breastfeed, you know it, and you just have to kind of gently back off and say, I understand. I think it's driven a lot by the men who are pretty horrified by the partners, by the idea. They also feel disempowered because the moment baby cries, if they're breastfeeding, they can't do anything for it. So that's quite difficult for them. But some now will breastfeed for a while, and they'll say they breastfed, but they quit after 7 days or so. That's a very, very common pattern that, or even, by the time they get out of hospital, they've just breastfed for a day or two, So for me, there's a world of difference in reach, working class girls. And in a lot of ways, it's things like saying, this is going to be the best thing. If you can breastfeed for a good long time, this will be the best way that you can get your body back in shape that you could possibly do for yourself, as well as the benefits for your baby. But things like that kind of carry a lot of weight. I think another thing I'd just quickly say is that I feel like the expectations, we say, oh, breastfeeding is great, it's good for, it's fun, it's fine. Well, no, it bloody doesn't. The nipple is not sorted for breastfeeding at first. And the first, while it's pretty uncomfortable, I think, whoever you are. And then this notion that a baby will feed every 4 hours. Again, no, it doesn't. It feeds for a long time and it wants to suck, even when it's not really hungry, just lie there, latched on, sucking occasionally, cause a lot of discomfort. There's a lot of kind of myths that we don't dispel early on and just say, it's not particularly comfortable. Your first few days when you're already incredibly sore and everything's not great, it's pretty unpleasant. But if you hang in there, it gets better, and it's nothing compared with what you've been through, would be very good messages, really. But for me, we've got to tackle the class issue, because there's a world of difference between middle class people, where I agree with a lot of what's been said. People feel very bad when they can't, and it needs dealing with very, very sensitively, and the world that we just don't seem to touch, I think.
Fascinating, Jane. Again, another really fascinating comment. We may be pulled away very soon, although I see Gabby's just put her hand up. So
I was going to say people are going to be coming back, James. Yeah, we can go to Susan, but just to let Susan, people are going to be coming back as you're speaking, if that's all right.
Okay.
Go ahead.
I think I agree with Jane. It's very unpleasant at the beginning, and it lasts for a few weeks before it gets better. So, then it's multifactorial: a class, support of family, all those things affect breastfeeding. So difficult to just pinpoint one thing as an issue, but if it works, it's very beautiful, as I have realized in our case. To breastfeed your child for almost 2 years, it's just a beautiful journey. But the first few weeks, my God, no, it's not easy. And even as a pediatrician, I didn't know what I had in store.
Thank you, Susan. Thank you. So, welcome back, everybody. From the far-flung reaches of other groups, we had a very, very rich discussion for those of us who stayed in the main room. Thank you to many for what you said. So for the next 15 minutes or so before we close, we can come back with observations, questions, insights, anything really that struck people about the conversations we've just had. Again, pop your hand up if you seem to be having your hand up and not being called. That's a technical problem. Please alert me, or please just unmute and come in. And Gill, Florence, Jenny, others who were part of framing this, we'd love you to comment, and we'll try and give you the last word to just sort of knit the strands together. But again, it's very informal. Just let's share the things that have struck us, or the things that we're most curious about.
So James, we've got Flo wants to come in, and then Claire.
Thank you, Suzie.
We were discussing the idea that the locking of stuff away is demonizing formula feeding, in that the only other things we look away are controlled drugs, you know, morphine, codeine, etc. And that exacerbates guilt and shame. Yeah.
Oh, fascinating. I didn't know that. Let me just check I heard you right. You say you talk about NHS hospitals in England or perhaps the whole of the UK. We lock up baby formula in the same way that we lock up the most dangerous and street valuable drugs.
Correct.
That is quite interesting. Can I ask, Florence, just not to overdo that point, but is that like a national directive, or is it just each hospital? Like, how come?
My understanding is it's part of baby friendly. But I stand to be corrected perhaps by some of the midwives on the call, but my understanding is that that's part of the baby friendly criteria to get your accreditation, and the milk has to be signed in and signed out on a named baby basis.
That's very, very interesting. Let's go to Claire, and then somebody whose first initial is J and their surname is Sun.
That's Julie.
After Claire. Julie, sorry, Julie, I couldn't see your name. Claire.
Hi, thank you. Yeah, so I think in our trust actually, we just don't provide formula. That's it. They have to bring their own in. So we had quite an interesting conversation around the fact that breastfeeding at discharge is a metric that the trusts have to deliver, and therefore the focus becomes on that rather than supporting women to make a choice for themselves, and how actually the choice to decide to breastfeed or not should really be more of a balanced one, where the women get given the pros and cons of each, rather than here's the advantages of breastfeeding and then not get told any of the disadvantages, and here's the disadvantages of bottle feeding and not, you know. And we had a conversation about how it is possible to measure things in a different way, and perhaps there should be a shift away from a metric that is, so target focused really, because then that becomes the total focus of the trust, and that's what comes down from the trust. And so then we got on to talking about kindness in the organisation, and how obviously if we're kind to each other as staff, then we're more likely to be kind to the patients, you know.
Thanks very much. I mean, there is that question, that phrase, Claire, isn't there? I don't know if it's just a purely British one. Being cruel to be kind. Do people know that who are outside the UK? I don't know.
Yeah.
I mean, just as I was listening to the last couple of contributions, that phrase just came to mind. I don't know. I mean, is there something in this that there's somehow sort of sitting behind all of this? It just feels like some body is saying, we know what's best for you.
Yeah, I think you're right there. I mean, ultimately, I don't believe any of the midwives intend to be unkind. I think it's part of the situation they find themselves and the culture they find themselves working in, and the time constraints. Another one of my bugbears is postnatal wards, which are essentially 2 patients in each bed, yet we staff them exactly the same as the rest of the adult wards, of one nurse to 8, when in actual fact on a postnatal ward it's invariably 1 to 16. Then is it any wonder that things get rushed and pressure is applied to get women out of hospital? And so we set ourselves up to be unkind, I think, sometimes.
Fascinating. Thank you very much, Claire. Julie.
Hello. Well,
come to you. Hello.
Yeah, we had a lovely conversation. I'm a mum of 6, and I'm actually very proud to say I tried to breastfeed one of them, which wasn't the first child, and it failed every time. So I've spent the last 35 years telling every pregnant woman that I meet that if it doesn't work, that it's not your fault. I think that's something that's really important, because if you send a mum down a route whereby she thinks that she is failing her whole relationship with that child changes. We know what trauma causes for children as they grow up. And I think it's just the reality is for some women, it just doesn't work. And if it doesn't work, I keep saying we all have the ability to run, but we're not Usain Bolt. You know, we can have children, but your body sometimes just doesn't do what you want it to do. And, you know, that was me. And through I've got 6 fantastic children who are aged from 35 to 22, and they're either doctors or they're head teachers or educational psychologists. You know, they've all done absolutely fine in life with formula. And, you know, so it's about being happy, being a contented mum, and this child thriving, and you as a parent being able to have a good relationship. You will not have a good relationship to something that is making your nipples bleed for 2 years and you start to hate.
Julie, thank you. I can't see you. I don't know if others can. I don't know if you can see other people, but the people all sitting forward and nodding and smiling as you spoke.
Yeah.
That was really very powerful. Can I ask what you do?
Yeah, I'm a
Juliet
population
Buckshaw.
manager. So I'm a population health manager for a primary care network. I had 21 years in pharmacy prior to that. So my eldest daughter is 35, and you know I've been around a long time. So my span and contact with people has been vast over the years. But it was only when I started telling people at the beginning, you know, 35 years ago, this is awful. I haven't been able to breastfeed, and the amount of people that then said to me, oh yeah, that happened to me too. I just don't tell anybody about it because it's that shame, the fact that you haven't been able to breastfeed. Do you know, there's lots of people can't do lots of things in life, and not everything is as simple as it looks. So you know, if you can't do it, just have that good relationship with your baby and the people around you. You know, and I said in the meeting, bottle feeding's not all it's cracked up to be either, because unless you get the right teat, it's as much as a nightmare as breastfeeding if you've got a difficult baby. So, you know, it's not all plain sailing either way.
Yeah. And Julie, can I ask you one other thing? What's your sort of take on why it is so, let's say, unusual or surprising or a little bit shocking for people to say it's okay if it doesn't work for you? Like, how's that come about?
Well, I think most people nowadays have this idea in their head, and I spoke to somebody the other day who said they were going to start expressing colostrum, you know, from 38 weeks pregnant. And I said, well, you know, if your breastfeeding doesn't work, it's absolutely fine. And they went, oh, but it will work. I said, well, there are occasions when it doesn't work, so it'll be fine. You know, if it doesn't work, it doesn't work. And I think just that reassurance to say, oh, right, so for some people it doesn't work, so that they're prepared that if it doesn't work, it is okay. And I think that is, you know, if we actually hit people with really breast is best and you're going to fail if you don't do it, then you're setting people up for mental health problems. You know, they don't need other problems. They've just delivered a baby. Okay, you know, people have been doing it forever. It's a bit different nowadays with the expectations in life, and you're expected to have your house immaculate. You're expected to go out with a full face of makeup on and look like there's nothing wrong and keep up with everybody. So the last thing you need is to be told you're a failure at anything.
I'd love to listen to you all night, Julie.
Me too, James. I've got James Searle who's got a hand up before we hand back to Jill.
Lovely. And Jane, you'll probably be our last, unless anyone has anything else burning, and then we'll go back to Jill. Jane. Oh, you unmute Jane, please.
It's only quite a quick thing, which I think that we do ourselves harm when we try to allow people to have very kind of fixed ideas, both about their delivery and their labour and about whether they're going to breastfeed or not. You know, certainly, you know, I'm going to breastfeed and, you know, clear cut like that. You know, a lot about giving birth is quite uncertain, and, you know, you do have to kind of just go in with, you know, whatever happens, as long as my baby's okay and I'm okay, that's all that matters. And the more we can encourage that, I think that's helpful, really.
Thank you, Jane. Well said. So Jill, you're off my screen at the moment. Can you pop up again? What do you make
Here
of
I
what
am.
you've...
Does that help? Does that bring me?
Yes, you're back.
Yeah.
There you go.
Hi, James.
What do you make of what you've heard, Jill, and what do you want to close with?
Well, I'm delighted. I mean, I basically, put out the challenge that anyone, if you mention this topic's got a story, and I happened to be in the same breakout room as Julie, who I've never met before, and she immediately went into a rant that really, really made me laugh. And I said, please share that in the in the plenary when we get back together, because I think, and certainly within our group, we picked up quite a lot of nuanced messages, people who had breastfed, hadn't breastfed, it was easy, it was difficult. But I think, I hope people have picked up that it's a very different story for different people, and to be kinder. And I think the kindness theme, it's just so relevant here. And I can see, I don't want to put, but I kind of do, my lovely daughter Jenny on the spot. Can you see Jenny on the screen? Because I think some of those comments that were made at the end around, just make mothers feel good, and they've got enough on their plates, without adding guilt and shame and so on. So, Jen, if you want, I've raved to Jenny about my kindness conversations, and I've left various family events to go and attend them. So it's your moment, Jen, if you want to have a go.
Well, I wasn't expecting to be put on the spot, so I'm not sure whether that's very kind, Mother. I'm only joking. Yeah, I think this session's been absolutely fantastic, and I think it just shows that, like you said, Mum, so many people have got a story around this, and I think there just needs to be a lot more awareness, really, among health professionals, that there are so many different perspectives on this. And for the women that do find breastfeeding difficult, they've just had a baby, so it's a whirlwind of emotions, hormones are all over the place, and the amount of sort of guilt and shame that some women can feel because they can't breastfeed. I think if there was more of an awareness from doctors, nurses, midwives, whoever it may be, that it affects some new mothers so much, and just more kindness is brought into those conversations, it just can make the world of difference. Like I mentioned in my poem, that GP that I saw at 8 weeks, honestly, the words that she said, she said my baby was thriving, and she's just such a special, lovely person, and it completely changed my perspective about how I was doing so far as a mother, and it just made the world of difference to me. We spoke a little bit in our group as well about how women can feel quite a lot of judgment if they're not breastfeeding, and I think the other reason why this GP made such a big difference was because she was so relatable. She's older with grown-up children, and she just mentioned something to me that suggested that she'd had similar struggles when she'd first had her children, and she didn't go into any sort of detail or anything like that, but I just immediately felt like, yeah, she gets this, and it made me feel more relaxed going to her with the problems that I was having. And yeah, I'm just so pleased that I got to share that example of a GP that made such a big difference to me.
Wonderful. Jenny, thank you. And how appropriate to have a mother and daughter combo bringing us home in this and all topics. And Jenny, in your capacity as daughter, mum, and poet this evening, thank you so much. Thank you all. I mean, over 50 people showing up in at least Northern Hemisphere, height of summer. I think that speaks, Jill, to how you positioned the topic and to the topic itself. So I would just say very, very simply, it seems to me wherever anyone is coming from, mum, baby, other dynamics, kindness is going to help you move further forward in a good way, however you choose to deploy it. That would be my takeaway. Thank you to everyone for coming. I don't know if Goran is in the room now. Goran, if you are, just give us one sentence about September the 18th, which is the third Thursday in September when we next meet. Goran, calling Goran.
I think he
Come
was
in,
with
Swedish jury.
James.
Okay,
I think he was with us,
so
but I think he's had to leave.
I will do it to the best of my ability, which is in one breath to say that we're going to have something musical from Sweden. And that's pretty much all I know, but it's related to kindness. So if that doesn't grab you, I don't know what would. And wish you a wonderful rest of day, evening, wherever you are. And September the 18th for a little taste of Sweden and something musical is when we next meet again. Thank you very, very much to everyone, Gill and colleagues, Gabby, Suzie. Thank you. Good night,
Great to see
everyone.
you all.
Bye. Thank you, everyone.
Bye, everyone.
Thank
Thank
you.
you.
Bye.
Bye, thank you.